I did find it incredibly interesting that the paper also looked at the patient's entire metabolic health, because even the first statement is about prescribing statins and to try to look out for the cardiovascular risk. And then there was also not the recommendation, the statement to test for type 2 diabetes. Those are two, and they're not, I mean, they're obviously liver related, but they're about the metabolic health, right?
Yeah. So I mean, they really go hand in hand. And I think the reason why we emphasize statins so much is that, yes, of course, it's, the number one or number two cause of death in people with fatty liver disease is cardiovascular disease. But for some reason, despite more than a decade of evidence, that it's safe, that they're safe in liver disease. So not only are they helpful in reduced cardiovascular risk, but they're actually totally safe. Especially in this population at enhanced cardiovascular risk. So we really wanted to emphasize that they should be used. There should not be hesitance to use them, because it's going to make your patients better. It's going to improve their health. And even patients with cirrhosis, with the caveat that sometimes you can have a higher risk of muscle inflammation and injury related to the statin in the context of cirrhosis, but it should always be considered unless there's a reason not to.
Dr. Abdelmalek?
Yeah, I agree. Despite over a decade, there's still um, in ineffective utilization of statins in patients at highest risk because of the concern of the presence of liver disease, and we are striving to kind of debunk that. They should be used if there's an indication for use. There should be no reservation about the presence of NAFLD and NASH in the background. Yes, they can be associated with some muscle discomfort in some patients, and maybe a little bit more so in patients with cirrhosis. However, our patients are dying of cardiovascular risk factors, and in fact, they can highly benefit from the statin. And there's also emerging data that statins may be helpful, in fact, in decreasing the risk of liver cancer, decreasing portal hypertension. Now, that is all an area of emerging research, but as of yet, there's been no concern about effective use of statins.
Okay, thank you for that. And Dr. Rinella, I know you got to go. Thank you for joining us. We got to do part 2 here. So have a great day.
Thank you very much. And again, sorry, I apologize for having to leave. Thank you, Manal.
That's okay.
Bye.
And
Bye. Thank
Dr.
you.
Abdelmalek, we'll continue because I have some more questions, and thank you. There's people want to know. Here we are. The other thing is, like we hear regularly the recommendations that you should exercise in this document. It's 150 minutes a week. That's statement 21. And then there's of course the weight loss recommendation for NAFLD patients 3 to 5% and over 10% for NASH. What was interesting too, and it wasn't considered a statement, maybe we're not quite there yet, was the 3 cups of coffee. So being a coffee drinker, I think that was kind of a great one to add in there to make people aware of that.
Yeah, I'm a big coffee drinker, so but I do encourage not only increase in physical activity and a diet that is enriched with fresh fruits and vegetables, grilled meats, Mediterranean style diet, basically the non-Western diet. So we want to move away from sweetened beverages, hydrogenated fats, the French fries and the hamburgers and the sodas, all bad. However, for whatever reason, there is a constituent in coffee, and it may be the phenols. A lot of research that suggests that there's a dose-dependent response in coffee consumption with liver health, an improvement in fibrosis risk or cirrhosis. And drinking 2 to 3 cups of coffee may not be so bad if one otherwise enjoys coffee drinking. But that's with the assumption, of course, that you're not going to drench it with a lot of cream and sugar. So, coffee is good, and I do encourage that from it.
Now, on the flip side, alcohol, the recommendation or the statement in the document is to reduce or eliminate, depending on how severe the liver disease is.
I agree. For any patient that has significant hepatic fibrosis. There's, in the presence of metabolic syndrome and obesity, there's evidence that alcohol, even in small quantities, can be what we call a cofactor, can be additive, if you will, to accelerating fibrosis progression. So in patients with NASH with significant fibrosis, the recommendation is to abstain from alcohol, such that you don't accelerate the potential risk for fibrosis progression. The data may not be as clear in other very mild states of fatty liver, and certainly minimizing alcohol, if not ideally abstaining in the presence of chronic liver disease, would be the recommendation.
Okay, that's all very helpful too. And I'm also cognizant of the time that we have. It's a big document and there's a lot of recommendations, 29. So is there anything else that we didn't already, touch on that is really standing out for you that we have to make sure is adhered to?
No, I think, it's one thing to have a guidance document that spells out detailed recommendations. And it's another element to educate our community providers and our patients on what these guidances are.
Sure.
So a guidance document without any following is really, makes no change, no ripple in the water, if you will. So a lot of interest and invested effort is going to rest on spreading the word, educating our providers, educating our patients on the element of these guidances, such that we can put actionable plans into motion and hopefully see health benefits from changes in clinical practice.
Well, I'm hoping this is a good start anyway. We had the two of you, we touched on a few things, actually quite a few of the statements in there already, but we definitely want to go back and do it again. I would love to have the whole group if it's possible ever, if we figure out the timing with everybody, but you're very generous with your time and I appreciate it. And we'll talk again soon.
Absolutely. Thank you, Michael. I appreciate being here.
Thank you.